Bonjour.
Good evening. I'm Dr. Ibrahima. I work with the WHO on emergency situations. As you can imagine, my team is working full-time to find a response to the pandemic, but there are also many emergencies, natural disasters, pandemics, and even the recent crisis in Tigray. Those are some of the cases. So my elder brother, SIDIBE, former Minister of Health in Mali, but former Executive Secretary of UN AIDS. So this, I think the speaker is going too fast. The speaker is going too fast. Today, I have the pleasure to preside with him these two sessions, and the first sub-theme, the role of digital health and innovation, and the second sub-theme is the place of local production in the pharmaceutical sector. So let's move very quickly to the digital health and innovations, and I would like to remind the members of the panel that they'll have 5 minutes to respond to questions. They'll be asked questions, but before, I would like to say a word to this theme, which is very important. As you are aware, the COVID-19 pandemic is indeed without any precedence, with multi-dimensional consequences. When we talk about crisis, we talk about victims, because there are men, women, and children and communities who are indeed affected. So where there is a crisis, we have lots of opportunities to do better and to prevent other events. This is an unprecedented digital era, but also biotechnology and other technologies. Life has changed radically because of technology, in particular during this COVID-19 pandemic. It has affected the way in which we communicate amongst ourselves and the way we learn and protect our health. The natives of this millennium are indeed digital people who are used to technology, whereas those who are older have to work to navigate these technologies. We must be aware that technology is just a very powerful tool. It is important for us to use it appropriately and to ensure that there is equity in what we want to achieve with technology. The millennials have benefited from technological development and digital technology, and some studies show that less than 30% of African women are online today. So technology as a force in our society could also lead to inequalities in our society, as well as inequality between the two different genders. People have to pay for food and for other aspects. But when we have access to digital technology, it could also be difficult to use them appropriately because of the illiteracy in our society. But it is very promising in the field of health. Let's talk about telemedicine with all the progress which has been made in this area. But technology also helps us to create knowledge in the field of health, to learn to protect the population, to spread message on how to behave. And the pandemic has also shown us how to use digital technology to carry out several transactions and to have contacts with our loved ones. So in terms of research in the African continent, there was Ebola, for instance, in the remote areas of the Democratic Republic of Congo. This technology was used by experts and it was able to seek vaccines and the discovery of new treatment. At the level of the WHO, of course, we are trying to make use of this technology as best we can to fight against this pandemic and to communicate across the world with member states and coordinate responses. At the level of our digital platform, we have been able to inscribe 5 million people for distance training in 45 languages in over 25 countries. So we see that a lot has been done with technology, and with our very important invitees, I'm going to introduce them. and I hope they're using technology equitably. So for the members of this panel, we have Dr. Adam M. SELAMNIA from the Health Digital Expert from the University of Luxembourg. We also have Dr. Ibrahima Khalilou, is a coordinator of the Health Unit for Health Digital Unit from the Ministry of Health in Senegal. There's also Dr. Moredreck, CHIBI, who is in charge of the innovation program in the regional bureau of the WHO in Africa, and Dr. Philippe Dontion, who is a executive director of UNTAC of the WHO in Geneva. For each member of the panel, we'll ask a precise question, and I'll begin with Dr. Adam. As a specialist in digital health, could you share with us some of the opportunities and challenges of digital health within the framework of the management of this COVID-19 pandemic? You have 5 minutes. I hope that you can all hear me. I'm very much honored to be here amongst these exceptional members of the panel in the presence of the minister and the senior officials of international organizations. And I would also avail myself of this opportunity to thank Professor Ibrahima, who extended this invitation to us. I would share my screen with you, and the slides will come up. Can you see the slides? Please confirm if you have, and you can see the question. Now, indeed, let me begin first of all with innovation. I would want to say that innovation is, of course, what response can we bring to health through innovation? I noticed that some countries, developed countries, ICIAT and other organizations, develop brevets. In Africa, we see different approaches in different countries in Africa. So we know that innovation is correlated to the GDP, and some countries do better than others. And I think it is something which we must bear in mind. In other words, the digital could be a source of economic growth. And we notice today that many countries find it difficult to provide a response to this health crisis. For each of these African countries, as I've just said, they have different GDPs, and the approach is different. So there are two levels. There are nascent industries in these countries, and this digital industry, we hope, will be able to help these Africans in their endeavors. Now, in this village, for instance, we know that doctors are lacking in these African villages. And compared to other parts of the world, you notice that the figures are really different. So there's a need to solve this problem, because at times you have to take a doctor from one area to move to other parts. So it leads to shortcomings. Now, the nature of the environment, as Aristotle said, entrepreneurs have worked, and the over 200 areas in Africa which have been identified, and the major enterprises, major pharmaceutical enterprises, are also contributing to the development of these sectors. And this affects many African countries. So we have startups which are emerging in Nigeria, Kenya, Egypt, South Africa, and in other countries which were not expected to be there. We notice that they too are actually emerging and succeeding in the use of the digital. There's also the creation of digital health, and this is indeed taken very seriously in Africa. And I think it is the most important resource in Africa because they work collectively, and this collectivity is indeed a very important thing in Africa. And this new technology is being used by many African countries. There are some local councils which do not have the opportunity. They cannot start in the use of the digital because there are difficulties. They may have computers, but they may not have the other necessary tools to ensure that they could go beyond this use of computers. So there are fundamentals which made it possible to start, but they need to go further. Of course, it is not because very little has been done that it should be abandoned. So amongst the startups who are interested in Africa, there are startups who start with Africans abroad in the United States who come back to open a branch in Africa, such as in Nigeria. And a group in Spain has opened a branch in Morocco, and we can talk about transfer of knowledge. And so this is a new era of transfer of innovation from the north to the south, and this is through a UNESCO program which has encouraged this practice, this program. Among the startups, I mentioned just a few of them. You can look on your right, some of them which have started receiving considerable funding in Egypt, in Ghana, of course, in Nigeria. And among the world startups, they are emerging and they're coming to the forefront. So we have 8 billion investors in Africa today, and it is not with this $8 billion that we're going to solve the problem in Africa. So it is important to work and to go further in this industry and see how you could set up productive ecosystems and see with these startups in different markets how they could be solvable, and it should be intra-African, between African countries themselves, because there's a multiplicity of cultures, of people, and these different startups should indeed emerge in a market which will be profitable. I've gone beyond time, and thank you very much. Thank you very much, Dr. Adam, for an excellent presentation. I couldn't really stop you like the first speaker. Now, so now I'll give the floor to Dr. Ibrahim Khalilou Dia for him to give an answer to the question, in this digital era, how has the fight against COVID-19 benefited from innovations in Senegal? Dr. Dia, you have 5 minutes.
Dr. Dia est là? Il est en mute.
Is Dr. Dia there? Has he muted his microphone? Dr. Dia seems to have some connection problems. He'll be with us in a short while. Can we move on to the next? We'll come back to him later. So to gain in time, I'll give the floor to Dr. Moredreck CHIBI from who is in charge of the innovation program of the Regional Bureau of the WHO. What has been your contribution in the fight against the pandemic? Kindly share with us community experience in Africa. Dr. CHIBI, please, you have the floor.
Thank you very much. Thank you very much, Chair. Indeed, COVID-19 has spurred innovations that were deployed for COVID-19 in the African region. So between August and October this year, we conducted a study which sought to paint the global landscape for technologies that were either piloted or fully adopted worldwide. What was really encouraging from the analysis was the fact that about 13% of these technologies emerged from our continent. Majority of these African-bred innovations were very much ICT-driven, which constituted about 57.8%. And this includes self-assessment and alert tools that have been adopted in almost all of our countries, and also including contact tracing apps that were also deployed in Ghana, Kenya, South Africa, and many more other African countries. We have seen an emergence of integrated health management tools like SOMAS in Nigeria, and about 11% were robot-based. We have seen the use of drones being replicated for pulling of samples for COVID-19 testing, and in Rwanda in delivering vital health packages to remote areas. You may also be aware that robots were also deployed in health facilities, which we have seen in Rwanda to reduce infection among healthcare workers. I was also amused when I attended a session on Tuesday to see Dr. Carr being celebrated in Senegal, which is a robot-based trolley to deliver food and other commodities for hospitalized patients in Senegal. So upon realizing the tremendous value that can be derived from innovation to accelerate improvements in Africa, as WHO, we immediately stepped up our efforts and institutionalized our approach in fostering development and scaling up of health innovations in the region. Priority is given to those innovations that can save the most vulnerable, as well as those innovations that can be deployed to the hardest to reach areas. So our journey for the past few years has been characterized by a number of innovative initiatives that we spearheaded, including the launch of the first WHO Innovation Challenge in 2018 that attracted over 2,500 entries. We are actually working closely with the best profiled innovators from this competition. We are supporting scaling up of their innovations in one way or the other. So since the onset of COVID-19, we have organized various events that sought to profile innovations that could be used for COVID-19 in our respective countries. We organized hackathons, organized webinars to showcase innovations from the continent, organized press conference that featured high-profile people on our continent, including our regional director. This was a way of bringing visibility to the innovations from the region, just to name but a few.
Thank you.
So WHO, especially in the African region, we are very much committed to continue to be a key player in promoting uptake of local innovations and digital solutions as a gateway to achieve sustainable impact. You may be well aware that as a first step to this journey, this cohort that I was talking about that developed homegrown solutions to meet pressing health demands, not only for their community, but across the entire continent. And this demonstrated the impact that these innovations can have on the health system. And also they've managed to develop business models that are self-sustaining.
Thank you, Mother. You can conclude.
Yes, so just to conclude, to this effect, WHO in the African region has since developed what we call the regional strategy for scaling up health innovations in the African region, which was unanimously adopted by all regional member states, which is geared to support strengthening countries' innovation system to make them more responsive to the innovation needs, and also taking into account the realities at country level. So we hope, as we continue to support implementation of this strategy, innovators and other actors in the ecosystem space will experience positive changes that will create positive impact across the region. Thank you, Mr. Chair. Sorry for...
Thank you, Moredreck. This is really encouraging to see that innovation is really people-centered, and we are seeing real public health outcome and impact. We will come back to it. And so, now
we have Dr. Ibrahima Khalilou Dia. Dr. Dia, in this digital period, has the fight against COVID-19 benefited from the digital innovation and others? And how is it observed in Senegal? You have 5 minutes. Thank you very much, Chair. In Senegal, we are lucky. At the beginning of the pandemic, the Minister of Health had a service, a digital health service, with which we worked. And it made it possible for us to have a vision, to have digital health plans. So when we had it, we benefited from the national ecosystem. Developers, computer companies, communicators, all of them worked with the Ministry of Health to make a contribution. So we came into groups, a group which we called DAN, which means fight against COVID or ban COVID. So there were many problems. At the beginning of treatment centers of the epidemic, we're able to see some of the patients. Doctors from their homes or from their offices could access to the sick, and all the information was centralized at the state computer service. So we also tried to do some tracking, and with the support of communication services, we were able to re-qualify what we call community cases. That is, COVID cases in the community. With tracking, we're able to find out where they contracted this disease. And in these communities, we noticed that some of the infections came from within their community. So we came up with a cartographic plan at the national level, which each day we tried to situate the epidemic. And the maps were made every day, the number of cases, the gender, and the area where the infection took place. So we made these maps also even at the national level. So this initiative in the fight against COVID, we went even beyond health, because we tried to help other sectors, like the commercial sectors, or even transport, for instance. So what we should retain here in what happened during this pandemic period is that we had problems, we faced problems. The problem of continuity of services, because doctors face problems with the mobility of some patients. They did not have information whether some of the sick who came had a chronic situation or not, and there was no way we could find out. So we only saw the need to communicate with the population, quick communication with the population. We had problems of data, because we had to act quickly, but we also had to provide data, because afterwards there was a need to carry out research to deal with the epidemic. So now I believe that there are other challenges to meet. We underestimate the use of the internet. Here in Dakar, it is a real challenge. In some hospitals, we had internet problems. We also noticed that it was necessary to be there every day for doctors to continue to get information from the information system that had been established. And we were in a haste, and at times this internet could stop them from doing their work appropriately. So the equipment was not available in certain places. So they had to look for tablets and other equipment to give to doctors. And those are some of the difficulties which we faced. So there's a need for a lot of application of the internet, but at the central service, there were lots of equipment, but there was no internet connection. So we had to go elsewhere or to another center to look for information. Another aspect of the was confidence between health, the administration, and the private sector, because quite often the situation may be such that people may not be ready, and consequently there was the issue of loss of confidence. Now, There were computer specialists, but in the private sector, there was a problem. What is interesting is to note that there is greater awareness now, and this is indeed extraordinary. This is very important. I'm in contact with two colleagues, and we're trying to strengthen their activities because Professor Marie Kosek here present, when she was a minister, that was when she established the digital center because it did not exist before. So she had the courage to create this service. And COVID has indeed confirmed that she did the right thing on this particular issue. So there's a need to strengthen and extend this service in the Ministry of Health so that it should become permanent. Because with COVID, therefore, in Senegal, even the president is talking about the need of the digital systems because these systems should be improved upon. We should make proposals, as he said, because he wants everything to be traced, to be identified, to be codified. And I think this should be the case in all African countries. It's a path which every country should follow. So this is good. Money is in itself is not sufficient to deal with this issue of the digital requirement. So money is one thing, but there's also the need for change and the commitment of all the stakeholders from all the different areas. And all the different areas should come together to what everyone must be informed, everyone must be committed. And that way we'll be able to digitize our health system so that tomorrow, when there is any such epidemic, every part of the country will have the necessary equipment to deal with it. And we will be able to benefit from what we'll have learned from the past. And that is, in a nutshell, what I wanted to share with you. And I'll be ready to take some questions. Thank you. Thank you, Dr. Dia, for this excellent presentation. You have indeed touched the real problem. We're happy that there's greater awareness, and the digital health is not a parallel, but it should be something that should be included in this change of behavior so that we'll be able to take the right decisions. And I believe it is important. And we hope that this will be extended to all of Senegal. Now, we will have to move from this session to another.
I'll move on to our last panel member, the president of UNITAID, as you all know. And you will tell us what are the funding mechanism for the access to some diseases such as malaria, HIV, TBs. How does innovative funding mechanism can help? Thank you very much. First of all, I would like to thank, of course, the organizers for having invited me, and especially the Professor Awamai Kolsek. I would like to congratulate and commend the organization of this forum that has a very important place in the environment of health and innovation today in Africa. So the director of UNITAID is Philippe Dunton. I am his representative here. I'm in charge of part of the portfolio, but first of all, I would like to say a few words on the place that UNITAID, the role that UNITAID has in the promotion of innovation in the health sector. First of all, we have the habit of separating what we call upstream. So from what is generated, innovation, academia, startups, all our new partnerships that develop products. We have new drugs, we have new equipments, diagnostic equipments that are built at this level. And before everything, all this goes downstream and be a reality for the patients and the communities in in the ground, there is a value chain that needs to be built. And this is what you see. We have, first of all, to think about the quality of the products, and we work with the WHO on the pre-qualification of products so that we are sure that they can be distributed. And then we have to negotiate on the prices so that we have affordable prices so that this innovation can be brought to everyone. We need to work on the supply chains, but also on the delivery. We need to work with the countries, the Ministry of Health, the communities, to look at the different channels so that this innovation can reach more and more people. And then our partners, such as the Global Fund, the Ministry of Health in different countries that have more means and resources, that will do the scaling up of this innovation. So I wanted, because we are in Senegal, even though it's virtual, I would like to give you the example that we are building in Senegal with the Dr. Michel SIDIBE in Mali and in the Côte d'Ivoire that we call l'Atlas. And that is meeting the needs of screening populations that are affected by HIV that are not brought to health centers and diagnostic centers. The same way that you have a pregnancy test, we allow patients to take care of it. Why not promote the self-testing, the self-screening with the HIV, work with the industry to have a saliva test that will allow people to do the test at home in the comfort of their own home, and through tools such as communication tools, electronic communication tools, they have access to videos that will allow them then to be connected to the health system. So we have this innovation, a technological innovation, the saliva test, the HIV saliva test. We also have electronical tools to connect the patient, but we also have a social innovation here, because we have to think with the different association, the Ministry of Health, the patients, what are the best way to really distribute this test and then to really help and assist positive patients and know that they are taken care of correctly. And on top of these, we wanted to go even further. Why not use the means at our disposal, the audiovisual, the television, the social networks? We have a partnership with the MTV Foundation. There is a series targeting young people that is trying to pass messages, to send messages on sexual health and the use of this test, for example. This is a very concrete way of investing on innovation. Today, we also work on COVID-19. This is the subject. This is a subject of interest for all of us, and I think that the key words that we're trying to push here in Unitate is how we can simplify care screening, for example, so it's like easier for patients. How can we accelerate the innovation, and how we can at the end transform the healthcare system so that this innovation can really, really meet the needs of the populations that we want to help. I'll stop here because I know that we are running out of time, but of course, I will be more than happy to answer your questions later. Thank you. Thank you very much for this very good work that you're doing. Unitate has been set up with a very innovative funding, and we can see innovation in the diagnostic, and this really help us and relieve us of the work that we're doing on the ground. So these were the panelists for theme 3, and I would like to take this opportunity to really, really congratulate all our colleagues for the work that they're doing on the ground, capacity building, but also all the young Africans that have worked in research and development for diseases such as malaria, TB, and and such, and HIV. I would like to thank my colleague. We've worked on robot malaria, and now I would like to give the floor to Michel Amala Sidibe. I've already presented him earlier with his world leadership against the HIV pandemic. He's also been an advocate of local production of pharmaceutical products in Senegal. So, Michel, you have the floor. Thank you very much. Thank you to my young brother Ibrahima. It's always an honor, a pleasure to work with you. I would like, first of all, to say that you're not here out of the blue. You've demonstrated during your professional career. I was there when you helped Mali to contain the Ebola outbreak, and Mali was, first of all, one of the country that was seen as a success. So what we are trying to share now is a question that is very close to your heart. And I would like to also take this opportunity to thank my sister, Awa Maricol Sek. I believe that Awa, no, you need no introduction, but everything that you have done for this continent will stay because you have helped us to really mobilize ourselves together every time it was necessary to face difficult issues and make sure that we overcame challenges. And today, with your permission, I would like to say that the question here is on equity. You've said it, you've mentioned it. It is about social justice. And I would even add that it is also about redistributing opportunities so that we ensure that the most vulnerable have access to vaccines and drugs. And today, the COVID-19 is really showing us clearly that if we do not really break this cycle of dependence, see, if we keep on having 25% of the world vaccines that are administered in Africa and having no vaccine that is produced on the continent, I think that it is clear that we'll never be able to answer in a strategic manner and in a coherent manner to meet the needs of our population when it comes to health. And I think, and I want to add because it's very important, the question that we have today, because look at it this way, it is a moral issue. When you look today at the United Kingdom, for example, they've started vaccination. When will we start? We've waited for 7 to 8 years, and I think that our Michael Sec is well versed in this to have available drugs for HIV on our continent. We've waited for 7 to 8 years, so we need to refuse such injustice. And we need then necessarily to really rethink of our strategies. And this is why the African Commission for the Organization for Drugs, because it's very important, because if we want to give a better health safety to security to our population and protect the health of every Africans, we need to make a priority of the production, the local production of pharmaceutical products. And this local production cannot be done if we are not organized. It is clear with the pandemic that has highlighted the necessity to really strengthen coordination within the African Union to improve resilience of our health systems by touching upon the question of innovation that was already mentioned, but also to make sure that we are better prepared and can anticipate not only the crisis, but also future crises. And I've heard Ibrahima Socé for quite some time telling us, you know, this virus is only a beginning. We'll have other viruses. And today we have the COVID-19 and we'll have other viruses as well. And so this is a world that is completely interconnected. Before COVID-19, we had more than 110 110,000 flights per per week. And so I want us to be prepared by learning the lessons of the pandemic and the ratification of the African Drugs Agency. We've seen with the coordination for vaccine action, thank you to the WHO leadership with Gavi, but Africa needs coordination as well, and that Africa is capable of offering a strategic coordinated response that is thought of with the regulation system that will put into place. Myself, I was in Dakar a year ago when we took the decision to put into place AMA. We had no signatories. Today we have 18 signatories. We have 6 countries that have ratified. We need 15 countries more to ensure that this agency is a reality. Now, I will not go over time because I know we are short on time, but I would rather give the chance to our 2 panel members, Mohamedou Sow, that is the managing director, a doctor in pharmacy, an expert consultant in management specialized in quality and productivity. He is also the founder of Teranga Pharma and the managing director of this entity. And without further ado, I would like Mr. Mamadou Sow, before giving the floor to Djibi Diagne, I would like to ask you, the Senegalese private sector is fighting and has been fighting forever to have a better pharmaceutical sovereignty. Many experiences have been carried out, experiments with relative success. What are the opportunities and what are the obstacles? The COVID-19 pandemics, could the COVID-19 pandemics really allow for more happy perspective? You have about 5 minutes. Mamadou Sow. Thank you very much, Dr. Michel SIDIBE. I would like to thank the organizer of this forum for having invited me. I would like to share our ideas and share our experience with all the panel members that are here. Since we do not have much time, quite quickly, just to answer, you've talked about the different project that took place, but I'd say when it comes to the situation in Senegal, you know that we've started the pharmaceutical industry started from 1969 in Senegal, and in 2017, in April 2017, we've had 2 multinational, Sanofi and Tis, that gave its share to Metis Pharma. But in December 2017, Pfizer, the group Pfizer, former world leader, closed. And so in December 2019, Medis, that had bought the shares of Sanofi, had also closed down. So you can see that there are real difficulties for local production to really start and have market share and be profitable. Of course, French speakers, African, when we look at the English-speaking world, we see that the production is really, really low in Francophone Africa. In Senegal, we have 2 main projects. One with us, Teranga Pharma. We are in pre-exploitation phase. We hope that we have the approval to start, and we have the Parenteros project that started a while ago and has started exploitation now. So also there is another project. Just to say that this doesn't really represent more than 5% of production today. So we import today 126 billion of CFA francs. What does it mean more clearly? I always say that €1 or $1 went back to buy a drug, meaning that we are strengthening employment in other countries and not in ours. We are poor countries and we need more employment. We need to secure production, but we also need to maintain employment. So before, after this picture that I've just painted with for you, so now we can talk about what is this sovereignty he mentioning. It is in 5 points to have a sovereignty over 10, 15 years because it is quite urgent. We need to identify the most recurring diseases in Senegal, which has been done. After that, we need to select a molecule that are seen as indispensable. And when this is done, we need to look at the production chain from formulation to distribution. And today, we think that we need to start right away with production and then with formulation and then with production and have a stock of priority drugs for at least 6 months because the pandemic has shown us that we need a security stock of at least 6 months, and also be able to really develop the branch of um, herbal medicine. It is a segment that is not really explored, and we need to work on it. These family of drugs that are essential in Senegal are antibiotics because we still have infectious diseases, we have chronic diseases, non-transmissible, such as high blood pressure, diabetes. We have an increase of our senior citizen being sick, and all these diseases that is really having a toll on the purchase power of the families. We really need to bring a response to the needs of the family. So one of the obstacles are the regulations that regulate the pharmaceutical activity. They date back to 1964, and we really need to reassess them, revise them. Also, the fact that there is no this availability, and also the VAT that is a problem. Pharmaceutical companies are always paying VAT because inputs are subjected to VAT. Another problem is distribution. Bulk distribution only exists in France with products that are consumed in Senegal. For example, a product can be produced in Senegal, goes to France, and come back to Senegal. This is a problem, and we need to really deal with this question. Also, public orders, the uh, the tariff of electricity is a problem as well because it is a weight on top. What are the opportunities? Well, the really the will of the Senegalese country, of the Senegalese government really to work on the pharmaceutical industries. If there is also an opportunity, it would be the fact that if we manage to put into place a strong and a brave decision, we'll be able to have performance contract with a public order that nowadays is one of the problems with local orders here. So the definition of a strategy, national strategy of development defined by the president with the PAP to a document. We believe that there should be a will to really revise and reform the legal text, because the legal text that regulate the environment is a problem. So we need to revise them so that pharmaceutical companies can really flourish. Also, when it comes to quality, because when we want to create a transformation, a structural transformation, if we have a pharmaceutical sovereignty, we need a structural change of our pharmaceutical industry. And so pharmaceutical industry should have a particular status of companies that do not pay tax for at least 10 years. Something that I would have loved to believe in, I say that maybe it will be good perspective is the gas and petrol oil discoveries that will help uh, companies, Senegalese companies. I've already talked for 7 minutes, so now I'll give the floor to others so that we can answer questions later. Thank you. Mohamedou, you could have even continued because it was so it was so interesting. I don't know if Jibinja is here. So I'll give you 2 to 3 minutes. That was just to say that in this perspective and with these opportunities, we've said the following. Francophone Africa, if you really look at all the pillar countries of the production, are countries from Northern Africa and India that are very, very competitive in the market. So even before the COVID-19 here in Senegal, because Teranga Pharma belongs to Senegalese pharmacists and doctors, because they decided that it wasn't normal that Northern African and Indians would compete in the world market and we would just stand back and watch them. So it is absolutely essential that Francophone countries, which is true in Senegal and in Cote d'Ivoire, to not create a competition, useless competition. It is very important that there is a certain coherence in the pharmaceutical policies within leaders countries, Cameroon, Senegal, and the Cote d'Ivoire. Those are the three countries that are really pushing forward the francophone pharmaceutical industry. Another element that is very important, in my opinion, is to guarantee. We talk about economic patriotism. So we need to really change the consumption behaviors. The states need to be tracking quotas. So I want to say that, for example, in Senegal, if today we say that 5 billion or 10 billion over 10 years will be reserved out of 25 to local producers, and that we work on fiscal incentives, but also performance contract. For example, take the example of metformin, that are products that are really used, that are used a lot here. All local companies are given exclusivity over 5 years, for example. So it is a contract over 5 years, but the state needs to give a warranty letter or also or a deposit in advance so that it can guarantee production. So another element that is essential to us is a support fund to investment, because at the end of the day, the production costs are huge, and one of the important element is the quality system linked to regulation and to the good practices. So in the industry, you are asked a lot because it allows us to guarantee the quality of the drugs. But it would be important to have a support fund that would help the companies to invest, but also to have a tax credit, because the fact that you have to pay tax at the end of the year, it's difficult. The state should say, I renounce the tax, and because I want uh, sovereignty, meaning that all the tax that should be paid, you use it, you take it back, and you invest it back in your production. Other elements that are important, I've talked earlier of traditional and herbal medicine. You can see that there is an emergence of the middle class in African countries, that in a middle class that's really attached to green products in a way. And so today, being able to have a plant-based drugs, if those plants are cultivated locally and then used by the pharmaceutical industry, and then it helps cure population. Can you see the value chain and then the development through academia? Ourselves in Teranga Pharma, we've started a study with the University of Saint Louis and doctors here in Dakar, because we realized through a certain hypothesis that red hibiscus was really efficient for hypertension. And so we wondered. We went even further. We have identified twice two agents, two constraint that we had were that constraint that we had was that we didn't have enough land to cultivate the hibiscus, but also how to renew the plants. But our ambition was to say, and I think it's the same ambition as the Senegal state, is to have the enabling environment to be able to develop physiotherapy. We have a very rich flora that should not go to waste. We also have another problem, a problem, but not really a problem, is traditional medicine. With the development of all these, it will help us to put more order in traditional medicine that is not well managed by the state. Thank you very much for such an interesting uh, presentation. Now, I would like, I think that right now we have about 30 minutes, but since it's almost the closing ceremony, so my brother, dear brother Socé, I don't know what you want from me now. Thank you, Michel. I think we've received a few questions in the Q&A box. I think that it would be quite interesting for our panel members to be able to answer. The first question, I think that it is from my colleague Issa Diop Touré, maybe for the regional WHO Bureau, WHO Afro. He wanted to know what was the role of the WHO Afro in innovation?
Rôle de l'OMS Afro pour stimuler l'innovation.
For him to give a more example of innovation and the role of the WHO in innovation. Moredreck, you have the floor.
Thank you very much once again, Dr. Socé. Here at WHO, we see ourselves playing three roles. One is to encourage or fostering development of innovations that will target the vulnerable population, as well as innovation that can be deployed to the hardest to reach communities. So we do this by launching innovation challenges, or even combining with other organizations that want to take up or organize these kind of challenges. The second, the second role that WHO sees itself is because of our direct interface with government, we see ourselves playing a role in influencing adoption at scale of some of the proven innovations. And the third role in which we see ourselves playing a critical role is communicating success of innovations, especially that are emerging from our continent, and that can save, that can be scaled across countries. So we pretty much see ourselves playing a critical role in surmounting the barrier that we see associated with scaling of innovations, especially innovations that emerge from our continent, as well as connecting innovators to funders, and also making sure that we can provide some strategic support, and also initiate strategic dialogues with countries to advance innovation agenda in their respective country. So very much in a comprehensive manner, we take innovation agenda in a very holistic and comprehensive manner. Over to you, Dr. Socé.
Thank you, Moredreck. Je vois une autre question de...
I see another question. I think Dr. Adams wanted to respond to that question. Please, you have the floor. The Atlas project. Perhaps I'm going to respond if the Atlas project is funded by UNITED. There are two things. First of all, as an international organization, we are very much committed in international partnership ACTA to accelerate the arrival of the vaccines, as Michel said, but also the treatment and the tests and screening. And you'll need new tests and treatment, and have to insist on that. But the unit has been very sensitive to the difficulties which different partners on the field face typically. And I think the Atlas project has benefited, therefore, from flexibility on our part. And it was also a good way to show that everything under self-care, in the manner in which we are doing it today, where our people today take care of their health, the patients, it reduces the pressure on the health system. So thanks to this project, patients go less to the health structure and are less confronted to the risk of contacting COVID. And all the partnership with associations, for instance, in Mali is very important. The network in Senegal and Cote d'Ivoire were also very important. So it's not only the patient who take care of themselves, it is the community which takes care of them through these tools. And I think it's a very good way of fighting this pandemic. Thank you very much. I see a question from Aissatou Diallo, who works in community development and social development. And I think that question goes to Dr. It talks about the place of community development in these innovations. Is there any strategy for community development? Dr. Jia, please take that question. Thank you very much, Chair. I believe that it's a very good question, because all what we do in the digital area is good for the population. If they do not adhere to these initiatives, I believe that there will be no digital work, because the health system will have to offer services which we call digital services of health. So there's updating a system which is new, and if there's no in-depth work with the population, we will not be able to attain our objectives. So we have to opt for the principles and values of communal societies. It is very important, because the digital must concern the populations and the rural populations too. So everything should be done to set up that confidence in the digital. And if the local people don't have any confidence in telemedicine and in what we are doing and distant medicine, it means that there is a problem somewhere. So it's a very important issue. Everyone in Senegal has to work in this area, because it will help in communal development. So it's a very important issue. And I think that we in Senegal are taking this into account. But we have to prevent using digital just to create, but it should be for preventive reasons. Thank you. Thank you, Dr. Jia. I think you've touched a very important aspect of the promotion of health, and also the fight against pandemics, because pandemics is at the global level, but the solution is always at the local level. So communal structures should be able to be part of the struggle so that we could have better results, because we shouldn't look at the pandemic as a mathematical issue, but it is not in terms of dynamism and intervention. And without the participation of the community, there will be no success. Now, let me give you an example, a technology which we introduced for the Ebola pandemic. And with mobile phones, we worked with the population, and we worked for about half a day. We used a whole day to see how we could follow contact. So it is important for us to develop this technology, because we don't have to wait until there's a crisis before we work with the government. We should improve on capacity building, and that is what we call preparatory work to promote health. in times of crisis. In times of crisis, we have a question for Dr. Su on the strategy in terms of primary resources, whether it's a dependence or independence. What is the strategy which has been adopted in regard to the primary resources of these drugs? Thank you, Doctor, for this question. Indeed, this question is fundamental for the success of the fight against this pandemic. That's why we don't talk of independence in the pharmaceutical area. It's only India and China today who are monopolizing this area, this market. So we are forced, we have no choice, but we don't have to do it alone. Senegal alone cannot do it. Cote d'Ivoire alone cannot do it. A segment of the primary resources will be African, because without that, countries on their own alone cannot do it. So perhaps passing through the African Union could be, that's a CDC and ECOWAS are possible solutions which could help us succeed. Thank you. Thank you. There's another question for Dr. Jia about non-identified persons in the system who face a lot of challenges to promote digital technology in this field. How can we help such people? The commitment of the youth, for instance, in digital health, for the youth who really want to do it. Thank you very much. Health has to open up to the private sector. We have a private sector, which is health. And so we have to open up appropriately to be able to benefit from the digital. But the question is, there are some digital issues which are quite sensitive. For instance, the content of a patient's file. And quite often, the data may not be managed appropriately. So there's a need to know about how to manage this digital information. So telemedicine is done online, and the content of the discussion is medical, and it is in a server, so it doesn't keep us at ease. So the head of state told us to elaborate, to conceive a sectoral plan 2020-2021, and in these 5 areas of the fauna, there's a decree which is going to come out, and we hope that before the end of the year, there will be a report to the president, and we hope that he'll be able to validate our report, and that way, this decree will enable us to work further in the field of health. We have not been able to come up with a necessary tool, but an approval cannot be given to telemedicine for now. It cannot just be given to someone who may not be able to take care of the patient. So it is not an easy issue, but we remain open, and we'll be able to do the work which we have learned in India. So we need you all, and that will help us achieve a goal. Thank you, Dr. Jia. I think it's very clear. There's the need for a legal framework, and I think telemedicine and digital inventions will make it possible for us to forge ahead in terms of surveillance and also sharing of information between doctors, so that it should not just be in hard paper form, and sending it from one doctor to another will become difficult. So I believe that we've already seen in certain cases that the data is well preserved, and when you go there even 1 or 2 years after to carry out an analysis, you discover that the information is still there. We've seen that in the treatment of patients in hospitals. We really need to come up from the paper era and go to the system of digital, but that should be within a legal framework which respects the medical secrecy, the ethics, and I think all of this is important. Now, in regard to the question asked by Dr. Ajay of including technological innovations, I believe it is very important. And as I was trying to say, many centers have been created which will propose communal solutions for the different communities. And that is using the digital technologies. And there are some people who may not have this knowledge, and all of them could be trained. And then the digital technology is for all, and it will bring complementary solutions for the society and the community. And I just wanted to add this to what Dr. just said. So increasingly, we're talking about digital sovereignty, and what the minister presented on money and on the African Agency, I beg your pardon. So digitalization of drugs, the industry, and all that will constitute a subject for discussion. And I believe that there will be a new inter-African presentation which will help in structuring this in order that such data, as said Dr. Jha, could be controlled here in Africa, and appropriate infrastructure will be had in Africa, and these are all issues which could be discussed. And I'd like to thank the participants for asking that question. Well, I don't see any further question. Now, I will give the floor once more to my co-chair, Michel, for specific issues for future areas. There'll be issues such as ratification, and there's a lot of work to be done for countries to ratify all of these projects. Now, talking about this digital technology, it's a tool. It's a tool which we should embrace because it is important for the lives and health of the people. Because since we're talking about health, all additional tools should have an effect on the lives of the population, on the health of the population. It should have an impact. So we don't need a platform to show that we have a digital. We should be able to use it in preventing sicknesses, in caring for the sick, in treating the sick, and all the health personnel should be able to use this and bring everyone to accept this digital. Because as the situation is today, we cannot work only on paper. In real times, the Minister of Health could, for instance, know what is happening even in the most remote areas of the country. And we should be able to have a mechanism that will make it possible to have information as quickly as possible so that decisions could be made even concerning the remote areas of the country. And today, we should be able to see how we can reduce inequalities as well in all the different parts of the country, regardless of where we find ourselves in the country. And so once more, I'd like to thank you all, and I'll give the floor once more to my friend Michel. Thank you, my dear brother. We have just been given a message that it's time for us to conclude. So I'd like to start by saying thank you for facilitating this session. It has been very useful, and I did not have the questions, but you had the questions. That was good. So I would especially like to avail myself of this opportunity to say that I very much appreciate the members of the panel and all those who took the floor. A very important issue, this digital. I think the very first thing which I can retain from all of this discussion is the fact that innovation is no longer hidden in a corner. It is part of our daily realities, of our daily life. There's greater awareness at the political level, and there's also awareness, certainly, at the level of the population to go a little bit faster with all what is under innovation. But I believe that it's not only the issue of innovation as such, but it is also its relationship, as Socé mentioned a while ago, its relationship with the capacity to be able to anticipate, to react quickly, to make decisions, and decisions even at the local level, but in real time. So there's a need to dematerialize, and there should be training, of course, and then there should be adequate funding, and we should look at the links between the private sector and the state, and then all the initiatives which today are of interest should be made, but especially we should ensure that this digital health should not simply be, it should be part of all our strategies, and that this digital health should be able to be managed transversally. So these are very important issues, and I'll continue by saying that it is important to look at this issue again, this issue of digital health all over again, with its relationship with the associations. The notion of inclusiveness has been mentioned, and how can we ensure that treatment could become more effective and real and be transparent for patients, and make patients the real actors of the transformation and open to the private sector. But at the same time, we have heard that there's a need for a legal framework, so that this legal framework should make it possible to lead to reforms, and it should go beyond the national level to become sovereign, to have digital sovereignty. At the level of drugs, I'd like to thank Dr. Mahmoudou Sow, who has been very relevant in what he said. And what I would want to say or retain from what he said is that, of course, there's a need to reform the instruments. We should look at taxes. It is important to establish space that will make it possible to make us go faster in terms of local production. But when we talk of local production, the major problem which we face, and I've lived it personally, when I was in Benin, Benin was indeed setting up a pharmaceutical firm for local production. I did 150 kilometers in Togo, and I didn't see any pharmaceutical. I went to Ghana and even in Cote d'Ivoire, same. So the advantage of the African Medical Agency is that it will make us move towards what I call a hub or an excellency pool, and that will indeed enable us to go faster in terms of quality, the quality of production, the attractiveness. But in addition to all that, it will enable us to avoid division, fragmentation. Today, you yourselves mentioned this, and I think it is very important when we look at, when we remove South Africa and North Africa, I think the rest of sub-Saharan Africa will not be more than 3% of the drugs we should consume at the continental level. To attain this goal, we need to go through this operation, this rapid operation. Until now, we have only 6 countries which have ratified it, and I know that President Macky Sall a year ago requested that this ratification become a reality, and I believe that Senegal will ratify it quickly. And it is when we have the luck to have, we are lucky to have AMA, and that will enable us to have a coordinated response at the level of the African Union in health matters, and that will also enable us to follow and look at the possibility of a shortage of the risk of shortage of medicines, and we'll have stocks for about 6 months and the necessary medical tools. But I also believe that we'll be able to provide medical advice on drugs which could treat, prevent, or we could use to diagnose all what we have as false drugs. But I believe that it is what we will be able to benefit from the free trade zone in the African continent, which should contribute in establishing, I believe, a true African medical market with more than 1.2 billion persons. I'll stop at this juncture, and once more, I want to say thank you for having involved us in this high-level discussion. It is just the beginning, and I would like to request all countries which are following this discussion, which have not yet ratified, to indeed avail themselves of this opportunity, especially with this COVID crisis. We notice that it is important to have the necessary mechanism at the continental level, which will enable us to coordinate and position ourselves with a greater weight in the market. Once more, thank you very much. And I would like to indeed thank Ibrahima for helping me as co-chair. See you soon, and thank you.